Hey there, and welcome. Today, we're going to dive into a condition that can sound pretty scary during pregnancy. It's called red degeneration of a fibroid. Let's break down exactly what it is and, what it really means for you.
So, what happens when pregnancy brings a pain that's, well, not normal? I mean, you're all set for the usual aches and discomfort, but then out of nowhere, you get this really sharp, intense pain. It's totally stressful, it's scary, and that is exactly what we're going to talk about today. All right, first up, let's focus on the main event here, that sudden pain. This is the big red flag that gets everyone's attention, and for good reason. It can be super distressing, especially during a time you're expecting to be joyful.
Now, when this is happening to you, it feels anything but common, right? It feels like an emergency. But it's really important to note that this is a recognized complication of uterine fibroids. Doctors see it pretty often, especially right around the second trimester. That's when everything, the baby, the uterus, is just growing like crazy.
So that brings us to the big why. What is actually going on inside your body to cause this kind of pain? Well, to figure that out, we've got to look inside the fibroid itself.
The official name for this is red degeneration. Fancy, right? Sometimes you'll hear it called carnaceous degeneration. But what it really boils down to is this. It's an event where a fibroid basically starts bleeding into itself. Why? Because its blood supply gets blocked. And that internal bleeding is what gives it that red name and, you guessed it, causes all that intense pain. So here is how it all goes down, step by step. First, you've got a fibroid just hanging out in the uterus. Then, pregnancy happens, and the uterus starts growing, and it grows fast. As it expands, it can actually squeeze or kink the veins that are supposed to be draining blood out of the fibroid. It's just like stepping on a garden hose. The flow gets blocked, pressure builds up, and boom, you get bleeding inside the fibroid. It's basically a deep internal bruise, and that's where that awful pain comes from.
Okay, so if this is happening on the inside, how in the world do doctors figure it out? Well, it's all about reading the signs, piecing together the clues your body is giving them. The number one clue is that sudden, really sharp pain that's located right over where the fibroid is. That spot will be super tender if anyone touches it. But that's not all. You might also get other signs that something's up, like a low-grade fever, maybe some nausea or vomiting. And if they run blood tests, they'll often see a higher white blood cell count. That's called leukocytosis, which is just your body's way of saying, hey, something's going on in here. So doctors can get a pretty good idea just from the symptoms, but they use imaging to be sure. The first thing they'll usually do is an ultrasound. Now, that might show some weird, mixed-up textures inside the fibroid. But if they're still not 100% sure, the gold standard is an MRI. That thing gives a crystal clear image. It can show the bleeding inside the fibroid without a doubt. And then you have your confirmation. Okay, so this brings us to what's probably the most important question on your mind if you're going through this. How do we fix it? What's the path to feeling better? And here is the really good news. The treatment is almost always conservative. That's just a doctor's way of saying they focus on making you comfortable and letting your body do the healing. So we're talking about things like bed rest, getting you some good pain relief, maybe some IV fluids to make sure you're hydrated, and just as important, a lot of reassurance and close monitoring from your medical team. Now, I really want you to hear this next part loud and clear. Surgery is the exception, not the rule. Seriously, the idea of removing the fibroid during pregnancy, a myomectomy, that is super, super rare for this condition. It's really only for the most severe cases. For the vast majority of people, the body is amazing and can resolve this all on its own with just a little help and support. All right, as we start to wrap this up, let's do a quick recap. What are the absolute key things you need to take away from all this?
First, red degeneration is just a fancy term for that sharp pain you get when a fibroid bleeds into itself during pregnancy. Second, this usually happens in the second trimester. Third, doctors figure it out using your symptoms and then confirm it with an ultrasound or an MRI. And finally, and this is the big one, the treatment is all about rest and pain relief. It's not invasive and it works really, really well.
Look, being informed isn't about creating anxiety. It's about giving you power. The whole point of this is so you can have better, more confident conversations with your doctor. So now that you have this information, I want you to think about it. What's one question you're going to bring to your next appointment? Thanks so much for joining me.